Welcome, everybody, and thank you for attending this Lunch and Learn session organised in collaboration between the Knowledge and Library Services at NCIC and Boost, which is the North East and North Cumbria Learning and Improvement Community, previously known as CLIC. So my name is Ashley Eaton and I am from the Boost team, and today we are joined by Susan Mann from NECS, the North of England Commissioning Support Unit, and Sue's going to be presenting for us Autumn 2023 vaccinations and what you need to know. She'll also be supported during the Q&A part of the session by Gayle Howarth, who is the specialist nurse for immunisation and clinical lead for complex vaccinations, who works part of the NCIC infection prevention team. So if you could click the next slide for me, Sue, that would be great. These lunch and learns are designed to be a relaxed and informal space for health and social care staff to come together and share experiences. Next slide, please, Sue. And then before we kick off, just some very quick protocols. If you could mute when you're not speaking, that would be much appreciated. Please post any questions in the chat, and we'll also have some time for questions at the end. Listen with respect and be present. Please pass on, share the learning, spread the word about these sessions, and please be aware that we are recording this session today. We will be posting a link in the chat to be able to give your feedback. So if you're able to complete that, it would be much appreciated. It's really short, just a couple of questions. We always like to get people's feedback on what they think of the session. I will now hand over to Sue. Over to you.
All right, well, thank you, Ashley, and thank you for asking me to do this. So my name is Sue Mann. I work for NECS, and I'm a commissioning support officer, and I'm currently aligned to the primary care team in North Cumbria, and I'm taking the lead on the COVID vaccination programme, and we're also working very closely with the flu programme. So just a quick introduction about why we are where we are at the moment. So I think many of you will know we had a request from NHS England for an accelerated vaccine programme this autumn, because there was a little bit of concern around a new variant of COVID and making sure that all of our very vulnerable patients are protected against both flu and COVID as early as possible, because they were expecting a bit of a peak. So last winter, we did see quite a bit more flu than we had in previous years. So it's been a request of our systems that we try and get as many people vaccinated as possible before the end of October. So many of our sites are busy doing that. So just a quick word here about the importance of vaccination. So we're particularly worried about our patients with increased clinical risk and those over 65. We want to make sure that as many people as possible are vaccinated, and hopefully that will reduce transmission. And this is where health and social care workers fit in. You may not need protecting yourself, but it's about protecting your patients and those you come into contact with. And last year we actually had more flu deaths than we did COVID deaths, which is kind of testament to the success of the vaccine programme for COVID, but also is maybe indicative of people not taking flu quite so seriously. So somewhere in the region of 15,000 deaths in England from flu, only around 10,000 from COVID. And I don't think that's been particularly highlighted in the communications that we've put out to the public. But we don't want to be scaremongering either. And that's predominantly in the over 65. So that really is a target group for us. So we are experiencing some vaccine fatigue in all the cohorts, so whether that's health social care staff, whether it's the immunosuppressed, pregnant women, we're experiencing this with all of them. And yeah, we understand people kind of got a bit fed up of this, but then we also have large numbers of people who are first to be knocking on the door when the new vaccine campaign is announced, and making sure that they've got access to vaccines as quickly as possible. So it's just about working with your patients to understand why they might have some vaccine fatigue, and in many people it's not that they are completely anti, it's just that they maybe are hesitant. Oh, I've had so many before, why do I need another one? And it's about explaining how you need to keep topping up that immunity. Who's eligible? This is kind of this is a very brief overview around the vaccine programme, and what I wanted to concentrate on here was who's eligible, and then for you to think about, where do I fit in this? Where does my patient fit in this? Where do my friends and family fit in this? So for flu and COVID, it's quite a lot of people, and there are a couple of priority groups in there. So residents in care homes has been a priority, and for the last 2 campaigns we've started the campaign for those care homes 2 weeks earlier than the general public. And the idea is that we get as many of our care home residents immunised before the rest of the cohorts, and it's about protecting them as quickly as possible. And North Cumbria are quite good at this, and we're currently, I think, at somewhere around 76% uptake in our care home residents, and we've visited over 90% of our care homes, and that work has all been done by the primary care networks. So then we've got all adults aged over 65. Again, that's about the risk there. So, and predominantly the deaths are in patients over 65. Then we've got our clinical risk groups. Now, these people with maybe COPD or diabetes. There's a great list of the at-risk groups, and this is where you need to be thinking about for your patients. Are my patients in this group, and are you mentioning vaccinations, and are you checking if they're taking these up? Health and social care workers, obviously, again, that's about limiting spread, not just about protecting you, but about protecting your family and your patients. And then household contacts of people with immunosuppressed conditions. This is actually quite low this season. We're a little bit worried that that's low, so we need to do some communications about that. It's lower than in other seasons, so we do need to kind of push that one. And also carers. Again, this season we've had a fairly steep drop in the number of carers taking up vaccinations, so the communications in the next couple of weeks will be trying to focus on that cohort. And then pregnant women, again, we've struggled with pregnant women, I think, in all of the campaigns, but numbers are a little bit low again. So it's about making sure that we're signposting those people to the right provision. So then for flu, it's all of those people we've just talked about, plus school-aged children and those in residential care homes, not necessarily older age care homes. And then one of our focuses this year has been on the 2 and 3 year olds with a nasal spray, and it's about getting those little germ breeders vaccinated, immunised, so that they don't spread it to grandparents. You know what a 2 or 3 year old is like. They're going to be climbing all over you. So if they've got it, you're going to get it too. So, and then again, thinking about where you fit in this. If you're a parent, please remember to consent to your child's vaccination at school. We have a massive school immunisation programme, which is being delivered by the school-aged immunisation service from NCIC. And they have a very busy schedule right through to the end of December. So how are we delivering in North Cumbria? So this is definitely a system effort. We have the primary care networks involved, and that's down, some of them are working with one clinic for the whole the PCN. Others are delivering in every single practice, and some of them are doing it as a regular thing. Others are holding bulk clinics, and some of them are holding clinics on a Saturday for flu and COVID of upwards of 3,000 patients at a time, and they do that to try and slot this in alongside the day job. We've got community pharmacies. We've got quite a good network of community pharmacies across North Cumbria involved now, and some of those operate on very specific COVID clinics on community sites. So we have St John's Church in Carlisle, for example, Newton Rig at Penrith, and then we've got the Globe Hotel across in the west where they operate. But vast majority of the pharmacies are doing relatively small numbers, but they're doing them regularly. They're maybe doing them every day, and they're on people's doorsteps. So it's about access, really, making sure we've got access for patients right across the county. And obviously we've got secondary care trusts doing not only their staff, but they are also doing inpatients who are long-term inpatients, or if you're about to discharge to a care home, it's always good practice to get those vaccinations in place before we discharge them. And the NCIC, Gayle, provides the specialist clinics as well for those people who maybe have an allergy, for some of the complex children or some of the very complex immunosuppressed cases. And as I said earlier, school age immunisation service, who are doing a very big chunk of population. So all of these partners are offering vaccinations either through the national booking system, through a local booking system, or you can find them on the NHS app, or by calling 119 for those people who are not tech savvy at all. The NCIC staff offer, I've put in the little slide here with the QR code, but I know they've also got roving clinics and some drop-in clinics. So all of the details of those are available on your staff intranet. And one plea is that if you've had your vaccine somewhere else, please let them know, because the trust are monitored on the staff uptake. And last season, NCIC were the highest performing trust in the whole of the NECS system. So it would be nice if we were there again. But yeah, we're not that I'm competitive, but I like to see that North Cumbria is doing well in all our cohorts. So do try and push as much as we can. So that's a very brief overview, but I'm sure some of you will have questions. So I can talk about the delivery offer, and then Gayle will field all of the clinical questions.
Thank you, Sue. That's great. Feel free to come off mute if you would like to. Put your cameras back on. If you've got any questions, or post them in the chat as well. I can keep an eye on the chat box as well. Sue, I've got a question, only because I'm nosy, to be honest with you. So how many people are in those cohorts? I mean, how many vaccinations are we hoping to get out in autumn for North Cumbria?
It's somewhere in the region of 80,000. We've delivered about 50,000, so we're at just at the end of week 6 of the programme. We've delivered somewhere in the region of 50,000, and that's split roughly equally between primary care and pharmacies.
Gosh, wow, that's a huge amount, isn't it? Incredible. Anybody got any questions for Sue or Gayle at all? We've got a very quiet group today.
Well, I think we've been round a few times on this COVID programme, haven't we? So not that it gets any easier, but
I have a question.
Hi there, hello.
Hi, I'm Warren from West Cumberland. Is there anywhere offering any COVID vaccination other than Pfizer?
So we've just got some new Moderna Spikevax coming into the system this week. It's an XBB variant vaccine that's literally just starting to come into the stock system this week. So I'm not sure we've actually had any delivered into North Cumbria yet, but there is a Spikevax one in the system.
Okay, thank you.
I'm Alice from West Cumbria. We have some apprentices at the hospital, age 16, 17. Are they okay to have the COVID vaccination that we have the PGD for, or do I need a separate one?
Was that the PGD? Sorry, Alice.
Yeah. The apprentices are 16, 17.
Yeah.
And I know initially we gave it to everybody if there were carers. So there's that PGD cover for the COVID.
Our PGD covers us, Alice, because they're employed by us. So your flu will be done under your written instruction, and your PGD, obviously, because they're employed by us for the COVID side.
Even though it says for COVID 18, if they're carers and they're employed by us, they can have it from 16.
Oh, yeah, we can do that. Yeah, if you've got any problems, just come to me. But we need to make sure that every member of our staff is protected and that everyone that comes in contact with our patients is in the healthiest way possible. And we do that by vaccination for that cohort. So we have the duty to protect the staff member, but we also have the duty to protect the patient as well. So that's why they would be included at that age.
All right, and for them 16-year-olds, it's better to have the inactivated, isn't it, than the intranasal, because of working on the wards with vulnerable people. That be right?
Right, that's a good question, because actually the guidance would be that the live attenuated vaccine was the better one for someone that was under the age of 18. However, when people are in a workplace, sometimes that is seen as a children's vaccine, and so for me, I would give our patients the choice, or our staff members the choice around it. I think that physically for you, it would be better to offer the inactivated vaccine, which your written instruction is covering you for. But if they had any health conditions, Alice, I think that probably would be part of your decision as well. So if they had other health needs and it weren't just the normal fit and healthy population group, actually the live vaccine would be the better one for them to have, and we can sort that out. You can come to me and I'll help you with that at any time. So it's
if they were on a ward where patients are having chemotherapy, immunosuppressed, the live vaccination.
Oh, that's really deep, Alex. Alex. Okay, so with the guidance around the spread, so transmission, so if one of our staff members has nasal flu, would there be a risk to a patient who was immunosuppressed? Yeah. So the real guidance is that only if that patient was something like having bone marrow transplant. So we do know that if we have, say, granny's having a bone marrow transplant, she's been isolated, and the best thing to do would be to keep grandchildren away for 5-7 days after live vaccine. However, if someone is on ward and mixing with lots of other people as well, so they may be immunosuppressed through their treatments, what we need to do is make sure everybody around them is protecting them too. So the live vaccine is okay in those cases, because they'll be mixing with other people and other bugs as well. So the risk of transmission is so tiny. Yeah. Right. So it's the encouragement to be vaccinated is what we need to make.
Just give them the choice then to have the nasal, or they can have the inactivated.
Yeah, okay. Yeah, absolutely.
That's good, thank you.
Brilliant, thanks Alice, some great questions there. Has anybody else got any questions at all for Stu or Gayle?
Should we be doing those? It's Alice again.
Hi there, Alice. Oh, you've gone on mute.
We were just talking this morning about patients on the ward, and you mentioned it a minute ago. Should we be involved in that? The patients that are in long term, and you just said going to the homes. Is that something that we should do or going to do or anything like that?
We've got a programme ongoing, Alice. So every patient who's 21 days, 65 or immunosuppressed, the wards are getting emails on a weekly basis with a list of patients that need to be vaccinated. If they have a trained vaccinator on the ward, that person is being asked to deliver those vaccines, and we've had over 100 being delivered last week. So we've got 230 patients currently, you know, roughly in and out of there. So we're about 50% way through it. However, we do have low vaccinator cover in West Cumberland. So if you and Warren were interested in doing any shifts for me, email me afterwards and I can send you off. I can send you off doing inpatients.
So we were just wondering who did
Sorry,
them
Joe.
we were just talking about who did them patients. Somebody was just talking about. We thought, oh, who does them? That's all. Yeah,
well, you're very welcome to come and work some shifts for me. Absolutely, the pair of you.
We go easy on the shifts at the moment.
Yeah.
But we were just interested to know.
Yeah, there's a big program in place, Alice. So it sits with my team really, and we're managing it the best we can through using trained vaccinators on the ward. So with flu, anyone can give that. Any registered nurse can give that vaccination without attending training, because we give it on a PSD, so a script.
Yeah.
But for the COVID, there's a requirement for us all vaccinators to have a training element to it. So it kind of separates it off. So we can't just say to the wards, any nurse can do this, because we have to have that training element met for the COVID alone, which is why it's still sort of sat with us rather than being completely handed over to the wards at the moment. But I am short of staff for you two at West Cumberland.
Yeah, there are only so many hours in the day, Gayle.
Just that when we go around the ward, somebody was asking us, and we didn't know.
Yeah, well, they should have all had the list today, because I sent them all out this morning.
Okay, thank you.
We better hide this afternoon then when we're going over.
Brilliant. Thank you both. Then I've got Diane.
Yeah, can I just go back to the children's flu? If somebody does request the live nasal flu, is that available through pharmacy?
I kind of missed a little bit of that, Diane.
The nasal flu, if somebody does request that under the age of 18, is that available easily through pharmacy?
I actually have a little bit of stock hidden in our pharmacy fridges at Carlisle, and I have a few nasal flus hidden away. So if you had any difficulty whatsoever, all you have to do is copy me into the email, the request, and I'll release those to you. We do, the nasal flu comes through a different system to our normal vaccine, so we do get a pack of 10 in at a time, and I used one of them yesterday, so I know I've got 9 stored away. I would really be doubtful if you would need any more than that in the whole programme. Come to me if you need me.
Yes, yeah. And for the written instructions, I don't have a copy of the written instructions for the flu for under. Did you say it had to be a written instruction for flu for under 18?
Yeah, so the same. Are you in the hubs, Diane?
Yeah.
So the same written instruction that you're using in the hubs is the same written instruction that we'd use for influenza. Yeah. So if there's any difficulties with it, though, I can issue with a PSD to do that under anyway. So.
Right, I'll check what we've got.
Yeah, check what you've got.
Yeah, for under 18.
Okay. It does say in the written instruction, because we have to accommodate that really small. I mean, there's a tiny amount of our employees which kind of fit outside the guidance of the Pfizer vaccine and the flu vaccine. So we have to make sure that our locally adopted policies meet their safety requirements as well. We have to protect them too. So sometimes it's just the paperwork that we need to tweak around how we deliver those vaccines.
Right. Okay. Thank you.
Brilliant. Thanks, Diane. Any other questions? We've probably got time for one more if there's any others, but no, I think that's everybody. Lovely. Well, thank you so much, everybody, for attending. Just a reminder, we have popped a link to the feedback in the chat. And we're always keen to hear what you think of these sessions. And if you've got any ideas on, a future topic or a speaker, anything like that, please feel free to fill that in. Our next Lunch and Learn session is going to be on the 22nd of November at 12:30, and we're going to be joined by Karen Kirk, who is going to be talking about skills for co-production, and I'll pop a link to that session in the chat now. It should be whizzing its way. So yes, we hope to see you there. Once again, thank you so much, Sue and Gayle, for sharing that with us. It's great to hear what's going on. So yeah, I hope everybody enjoys the rest of their afternoon, and thank you once again.